You mentioned ginger too. Let's talk about ginger because you've talked a lot about ginger for like nausea and digestive benefits, but you and I were looking at some of the papers on it, and it does have a lot of really anti-inflammatory benefits too. So that's kind of cool. We're saying that it's a digestive aid, but also a systemic inflammatory aid, correct?
Yeah, I try to add things into protocols that just have a wide net. So I love ginger because one, it's a natural bitter, so it will stimulate digestive juices. Two, it's an anti-inflammatory, so it's very calming. Three, it's a prokinetic, so it helps the digestive tract empty. Because if you have like some kind of chronic inflammation or gastroparesis, food and acids can sit in there too long and create burning. Four, it helps with coagulability, so it helps with coagulation, so it decreases it, so there's less clotting, so you improve blood flow. It also helps with blood pressure as well. So a lot of, and then also it's an antibiofilm. So if we're using ginger to help with killing, it can actually help strip the biofilm, which are the protective shields that bacteria use to prevent themselves from being killed. So it helps with the biofilms, which allows the herbs we use to be even better. And again, the enzymes we use also help with biofilms too.
Yeah, a cool study here was just saying that in rat models of liver cancer, ginger extract counteracted oxidative stress and inflammatory damage, and it restored levels of superoxide dismutase, catalase, glutathione, and prevented an increase in COX-2, which is one of those pathways you and I were talking about that like some of the natural NSAIDs work on. Ginger is basically a natural COX inhibitor.
Yeah, it modulates, right? The problem with a lot of the COX inhibitor drugs of the early 2000s, like Vioxx, COX is called cyclooxygenase enzyme 2. That enzyme is also very important for repairing the gut lining and repairing the heart. So if you block it out altogether, like Vioxx did, you can destroy the heart and the gut lining. So with herbs, it tends to more modulate, not overdo it, but bring it down in a modulatory kind of gentle way, kind of like an adaptogen works for adrenals and cortisol and stress. Doesn't
Nice.
shut it down, but it just pushes it in the right direction.
That's an awesome way to think about it. So ginger is an anti-inflammatory adaptogen.
Yeah.
That's
Yep.
pretty cool. Okay, let's hit the others too, because there's others we use in blends. How about some of the polyphenols, like the quercetin, the rutin, the resveratrol, the rosemary?
Very
So
helpful.
I talked about Japanese knotweed earlier. The main benefit of the knotweed is because of the resveratrol in it. So
Yep. Japanese knotweed. Yep. That's very helpful.
it's amazing for like rheumatoid arthritis, like I said, Lyme type arthritis, which a
Hmm.
lot of RA probably is Lyme, but it's been not properly diagnosed. So I love those. I mean, I personally take some sort of that all the time. And, quercetin, I love too. It's in the vitamin C family. I love it because it's a great mast cell stabilizer. So if you are dealing with mast cell activation, in the case of mold toxin or Lyme or Bartonella, Babesia, Auriclia, Mycoplasma, any of these things, even viruses that are triggering mast cell problems, and you have all this histamine out in your system, the quercetin is really going to calm that down. So that's why I love it. And you can do too much of a good thing, but in general, something like 250 to 500 milligrams 3 times a day of quercetin for me is a game changer.
100%. I would say next we could do curcumin. Much better off to take it liposomally. That's very important. So liposomal curcumin. Also, make sure you cut out nightshades. Nightshades and of course grains and refined sugar can create joint issues. So you'd be surprised how many people that have chronic issues just making those changes help. So liposomal curcumin for better absorption.
Why the
And I know you
nightshades? Will you riff on that for a minute? Because
The
nightshades are
solanines,
something.
the alpha solanines, they're compounds, they're anti-nutrients in the nightshade family, tomatoes, potatoes, eggplants, peppers. These alpha solanines can get into the joints and they can kind of create a lot of inflammation. Similarly, with people that have oxalate problems, oxalates can get into the joints, these oxalate crystals, and create a lot of pain issues in the joint tissues, in the muscle belly too. Now, again, I don't go into oxalate restriction out of the gate because there's a lot of healthy foods that have oxalates in them, spinach and green vegetables. So if someone's coming off of a processed food diet, the last thing I want them to do is now be worried about oxalates because that restricts a lot of vegetables. So I don't worry about oxalates out of the gate if someone's diet's crappy. So
Well,
I would work on getting their diet really clean, and then potentially in some organic acid tests that we do, we could see if oxalates are really high. If do they have a history of kidney stone problems? Those kind of things are helpful.
yeah, and don't forget to mention too, candida. I mean, we'll see oxalates driven
Candida.
up tons
Bingo,
from a
fungus
yeast
issues.
problem.
Yep,
So I've seen people on like a low oxalate diet for years. They still show up off the charts and they're having these joint pain
yep.
issues. We simply just fix the yeast overgrowth or the fungal problems, and then the oxalate markers go down and their joints are better. So make sure that when you're doing a workup on these type of issues, whether it's mobility or pain or otherwise, make sure you're looking for these fungal colonization markers. You're looking at candida, you're looking at some of the bacterial overgrowth, because all
Yep.
these things are going to act as, we'll just say, a toxin in the bucket. And if you get this infection plus that infection plus yeast, then you really have a much, much higher chance of having these problems. And you go take the ibuprofen, you're not knocking any of that stuff out. The yeast is still there.
110%.